back with the Stay in the Game podcast, and I am your host, Trevor Field, physical therapist and owner of Form and Function Physical Therapy in Rancho Cucamonga, California. Welcome back, guys. I know it's been a good hot minute since we've done one of these, so my fault on that. If you know me, there is a pet peeve of mine that when things don't work that should work, ooh, the rage. So what happened was I actually recorded an entire podcast. Some of my best work, I thought, sent it over to our studio, had our production manager try to clip it all together and make it all beautiful for you guys to listen to. And I get a response back maybe an hour after I upload everything. There's no audio attached to this. And I was like, oh my God. So, it's one of those where you take a beat, you stand up. It wasn't a death blow. We get back up. We push on. Here's our podcast. Hey, and it's going to be a good one, guys. So we're going to go make a deep dive into back pain, cover some of the questions I frequently get, and actually make this very much more patient-centered focused. So I'm not going to go deep in depth, get terribly technical with you guys, because I'm going to be speaking to you, the patients, you back pain sufferers out there, and try to get it to your understanding. So hopefully this hits the mark with you, and it's a good one for you. But what else has been going on since we've last been on a podcast? So first, you're going to see a familiar face, maybe with a little less facial hair, but I found myself on the cover of Health Expert News magazine. I was featured as a shoulder pain expert and contributor to Health Expert News. So also can find some new content over at Shoulder Pain Expert, ranchocucamonga.com. So a new site specific to kind of some shoulder conditions. So if you're dealing with something like that, go check that thing out. Really proud of that work. And I know some haters will look at this podcast and look at the cover of that magazine and be like, damn, isn't that the same blue shirt? Well, way back in the day, not to say I'm as important as this guy, but the stories were Obama would wear the exact same shirt and exact same outfit every single day because he didn't want to have to make the decisions of and the time it would take to make that decision. So I'm not the leader of the free world. I don't have the weight of that, of the nuclear codes or the button on my agenda, but it makes a ton of sense to me as a business owner and somebody who's got a ton of things to do, that if I can cut something out of my day and have a little less stuff going on upstairs and clutter and otherwise, then we can move forward and clean it up. But truth be told, two other things. One, not a huge fan of shopping. Number two, I've hated everything that anybody's ever gotten me. So that leaves me with, just digging in the closet and grabbing similar items every single day. So, but go check out that. I'm very proud of it. Health Expert News featured there. And what else is going on? Well, went kind of viral. I don't know what the quantitative analysis, the number you got to hit to actually say that you went viral, but one of our YouTube shorts that I recorded a long time ago, and we repurposed some of this content, and at last look, I saw this thing approaching 300,000 views, ton of comments, classic internet comments, and if you know what I'm talking about, ton of hate, ton of just, garbage going on in there. So I would love for you to check it out. It's very simple. It was a simple post specific to a couple of Philadelphia Eagles wide receivers having a conversation. Greg Ward was talking to his teammate Devontae Smith about an injury he sustained, basically bruise, contact, and was saying, hey, I'm going to use the percussion gun on it. And he's like, no, you don't use a percussion gun on this. It's all voiced over, and I'm sitting in the front talking on it, saying, hey, just giving an overview of what's happening and speaking to how people don't understand when or when not to use a percussion gun. And the comments blew up about, oh, I didn't learn anything. And, it was one of these reading is hard moments, kind of hilarious. So the people who actually did read through what that conversation between those two NFL players was, they got it. The people who didn't get the point of the post. But go check that out, laugh at some comments, laugh at me voicing over some of these NFL guys. But it literally overview of all of it was reach out if you have questions. And out of the over 100 comments or so, 0 questions. So people love to comment, love to spout hate and spout their opinions when they're really not adding to the conversation. So we're here to add to the conversation. We're here to answer your questions. We're here to get you good advice and talk to you about what to do, when to do it, when not to do it. And if you have questions, we've made ourselves available in all of these methods and platforms for you to get good quality information. So with that being said, let's jump right in. Let's talk about the back. First, I wanted to discuss just some simple anatomy, simple understanding of what the structure of the spine is, what it does, what it's for, why it's important to kind of all of our movement, and how some of these things can interplay to other problems that go on in the body. So when we talk about the lumbar spine, there's 5 segments down there. So if you've dealt with problems, if you've had images and they say L2 or L3, you don't understand kind of what that means. Well, they're numbered from top to bottom. At the top starts at L1 and goes down to L5. And then you've heard of an L5S1 if you've looked at other kind of structures or read reports or had MRIs or done any of these things. The S is for sacrum. That is that triangular bone that sits down at the bottom of the spine. So these 5 segments all have discs in between them. So the segments are actually the bony kind of blocks that sit upon one another, and the discs sit as the cushion in between. So the structure of the cushion of the disc, we need to have some understanding of it as well. So let's dig into the disc. So the disc has an inner third of it being a gel nucleus. And the purpose of that gel nucleus is to absorb water. So 70% of the structure of the disc is water content. So you may hear a little bit later about some tips and tricks about why hydration might be important. So stay tuned for that. But the outer 2/3 is really that kind of gristle-like substance of the disc. So that's that hard, kind of tough, helps you shock absorb for all of your daily life activities, lifting, bending, jogging, running, sitting in a car and having all this vibration. That shock absorption really does serve us. However, life gets going and gravity starts beating on some of these things, and that tough, resilient, gristle-like structure actually becomes soft and mushy, and that gel nucleus begins to migrate and push back toward the back portion of that disc. So this is where disc bulges, herniations can occur, where discogenic back pain occurs. So let's talk about that. That disc, that inner third, that gel nucleus starts migrating and pushing back. Well, the inner 2/3 of the disc have 0 innervation. So I can go through and push through and break and damage and tear a lot of this disc tissue, and I really have no perception of any kind of pain, any kind of problem happening. It's that outer third that actually has some level of innervation. So you can get some central disky type back pain. Feels deep. Occasionally what you'll get is when we have pain, your body has a withdrawal response, basically a tension that begins to occur to help support and guard these issues. So we beat down a disc, it gets mushy, the structure becomes unstable. So that instability, your body tries to correct this instability by bearing down and basically tightening this area up. So a lot of people attack back pain issues by just either stretching or doing some of these other kinds of conditions. We're going to get a little bit deeper into why you should, why you shouldn't, why maybe we go one route or another. We'll talk about it, but this becomes like why this becomes such a complex issue, why we really haven't solved it, why there isn't a one size fits all, one size fits most kind of treatment for back pain. So we've gotten through the disc. We've gotten through kind of numbering and talking about the levels of the spine. Well, there are 3 joints per segment in the lumbar spine. So next we have the facet joints. The facet joints are these, they assist in guiding motion. So in every level of the spine, they have different orientation. So in the cervical spine, they sit a little forward. They allow a little bit of rotation up, down, left, right. In the lumbar spine, they're very vertically centered to allow us to bend forward and back. So not much of our lumbar spine allows for rotation. There's a small amount that occurs, but that isn't the purpose of the lumbar spine. It's not to rotate, it's to flex and extend. So the facet joints can take a little bit of a beating through all of the same methods we talked about. Oversitting, core becomes weak. We start to stress some of these things out. And what can happen is the facet joints themselves begin to degrade. They begin to break down. So they can become somewhat unstable. When we start to weight bear improperly on them, the bone actually starts to remodel. It grows, it hypertrophies. So that thickening or growing of the bone can lead to conditions like stenosis and a few other issues. But the facet joints themselves can become somewhat stuck. And the facet joints throughout the spine, these are the guys that snap and crackle and pop. And these are the things that chiropractors and physical therapists will manipulate to try to restore normal motion if that facet joint has gotten locked. So we also have a dense network of ligaments, tendons, those spinous processes. So if you kind of run your finger right down the center of your spine and you feel those bones, that's called the spinous process. These spinous processes are actually the attachment of the tendon to the muscle. So they attach to these muscles and allow the spine to move. So the spinous processes themselves can become very tender due to over stress. So if I'm somebody who's constantly bent over, if I'm constantly stuck in a chair, I sit too long, I get into a bad posture, things start pulling. Those spinous processes themselves can become quite tender to touch. So those are kind of clinical signs that we can look at to identify, is this truly a problem for me? Am I dealing with more of a repetitive stress issue of kind of lack of variety of movement throughout my day? Or am I dealing with something underlying all of this? So I think that gives us a good idea of kind of the general structure. Well, what kind of muscles do we need to deal with in terms of making sure the spine itself becomes stable? And the critical one for me, there's four kind of abdominal core muscles that we need to talk about. So you've got rectus abdominis. This is the one right down the front. This is those six-pack abs. It's a vertical muscle group that allows for flexion of the trunk. It's what a lot of people think they need to build when they're trying to create core stability or strength to help support their spine. It's absolutely not the muscle group that we need to address or kind of go after. So things like crunches, things like sit-ups probably are not the best route that you would need to train to get rid of back pain. We've got internal and external obliques. These are the guys that help the trunk rotate. And then the final one tends to be, to me, the linchpin of all of our core stability issues. And it's called the transversus abdominis. This is the internal back belt. This is the guy that kind of surrounds and creates that waist lining effect of your core, your midsection. So this guy, when engaged, is the stabilizer to that center part of your body. And if this guy becomes deconditioned, if it gets out of shape, if it doesn't have the kind of capacity to meet the demands that you're putting on your body, that's where breakdown is going to occur. So some kind of classic signs and signals that that muscle is not doing its job is that you hold your breath a ton during any of your activities. So your body's trying to cheat and find a way to create stability. So if you bear down, we're creating that stability around the spine without using your transversus abdominis. Well, that's cool. We found a way around it, a little cheat code, if you will. But if I'm bearing down, I increase inner abdominal pressure and inner discal pressure. So there's some good studies that show that the disc pressure goes up. Well, what's the problem with that? If disc pressure goes up, disc gets pushed out. So that's where, if we're dealing with a disc bulge herniation issue, we need to eliminate some of our breath holding, recondition this transversus abdominis muscle, and get you back to proper health. So that's what I wanted to talk to you about, kind of with just the general anatomy. And I know I threw a lot at you all at once and real quick. So in the comments, if there's something you feel like you didn't quite fully understand, hit me up. I'd love to go over it in great detail with you. I have so much to talk about, so I'm kind of just going to throw this at you. The back itself is such a complex issue. I could do 40 minutes a day every week for 2 years and probably not touch on everything that you would need to talk about in the back. But the next move from anatomy, I really wanted to kind of move on to the actual conditions that a lot of people deal with. So one place I wanted to start was just, how do you I just strained my back. I just pulled a muscle, right? So it could be something where I bent over, I lifted too much. But a lot of people get these back strains from conditions not related to heavier workloads. Well, how does this happen? So this back muscle or spasm or strain that's occurring, like, is this truly just a mechanical pull of the muscle? Muscle pulls are one thing, but I would say more than 80% of the time in my clinic, they're not related to this one time I picked up something or I had to move this thing 50, 60 times and now it's just, oh man, it's just been an overload stress issue. Because typically those things go away. They tend to get better. By the time you find your way to a physical therapist's office, you're coming because it's not getting better. And there's something maybe underlying all of these issues that caused you to be vulnerable enough to strain the muscle. So more commonly, it's actually this breakdown that we talked about. The transversus abdominis is not doing its job. We've created stress into the disc. The disc becomes mushy or unstable, and now these muscles are working overtime to try to create stability. And now we've done whatever we've done to lift, to move, to twist, to pick something up from the ground. Bang. Now we've got this muscle strain in the lower back that we've got to address. Well, how do we do it? Is it just, chill out for 2 weeks and let it go away, which is the typical? Do I get just to the medicine cabinet and pull out some Motrin or Advil, or what do I do to kind of properly address this issue? Is it heat? Is it ice? How do I address it? So for me, what I want to get into is, one, we've got to figure out the why, the true why. Is there an instability issue? Is there, because for me, like, I never want to see somebody shut down, lay it out for 2 weeks. It's never the advice you want to hear when you go to a doctor, like, period. Half the time you couldn't do it if you wanted to anyway, because your life, your lifestyle, the demands of you to get up and do things just is going to preclude you from getting there anyway. So it's kind of, yeah, that'd be nice, but I can't. So how do I really, truly, properly address this? And one, stay safe, and two, get to the root cause of getting this solved as fast as possible, efficiently as possible, completely as possible, so it doesn't come back anytime soon. All right, so if it's an instability issue, we've got to have a proper assessment. We got to get in the hands of somebody who actually does this. So I'll tell you, if there's a week that goes by that people don't come in and say, hey, I went here and, I just didn't trust the advice that I got because they went to somebody and were tried to be sold on a program or otherwise before they kind of had a full understanding of what's going on. A proper assessment is absolutely essential. There isn't a one size, as I mentioned, fits all program. You can't just go online, buy this thing, take it home, and 100% of the time it's going to work. There's probably a good number of people it's going to help, maybe even up to 80%, but is not helping 1 out of 5 of my clients acceptable? Not even close. Like, you got to make sure that we get this taken care of at a depth of understanding and knowledge that, like, you can't miss. This is a layup. You can't miss it. So for me, a proper assessment is absolutely essential in taking care of these problems. Is it an instability issue? Is there a capacity issue of my hamstrings, my glutes, some of these other muscle groups that might be contributing to these type of problems? So beyond the muscular strain, I wanted to move on into what's called DDD, a degenerative disc disease. So you may have heard some of this. It was like, oh, is this just inevitable with aging? Is everybody that lives long enough going to develop DDD? Well, there's going to be some findings of a lower back degenerative disc just based on aging, because what we actually start to see is in imaging studies, even in the early 40s, and in some cases I've seen even 30-year-olds start to see what's called disc desiccation. So if you've seen this in an MRI finding, what the heck does that mean? It's actually a drying out of the disc. So we talked about the disc being 70% water. Through those methods of stress, whether it is, I've been doing something incredibly physical, I lift weights, I do tons of driving, and all this vibration has actually created a ton of stress into my disc, and all of that kind of bouncing around has actually caused that disc to become mushy. You're actually going to begin to lose water content. And water content's huge because that water content helps you cushion, helps you support the spine. And if I begin to dry out that disc, the disc itself begins to thin. We lose some of that thickness between the segments. Well, that leads us into a couple of other conditions that we'll talk about, but the drying itself isn't necessarily the issue because drying doesn't necessarily cause pain. The thinning may, because we're going to change some of where our weight bearing goes from the disc itself back to the facet, because now if we've lost that space, those other two joints of our three joint per segment structure is going to take that beating. So, or at least handle the load per se, not necessarily a beating, but you get me. We lose a little bit of elasticity. So in some cases, yeah, you can see stiffness start to occur in that DDD issue. Not necessarily a disc bulge or herniation, because if we've lost some of the elasticity of the disc, its ability to bulge or protrude is actually minimized. So if we're dealing with nerve issues of DDD, it's not necessarily from a disc bulge or herniation. It's actually from that loss of space between those segments. So these nerves actually exit between the space of those segments, and you can develop something called stenosis. So stenosis is that narrowing, that thinning. And stenosis can come from not only the thinning of the space between the segments from disc desiccation, from degenerative disc, but it can also come from that weight bearing into the facet joint. So the facet joint, as we mentioned earlier, all of that weight bearing into the bone only knows one thing to do to try to fortify itself to be able to handle this new load, and that's make more bone. So if we start laying down more bone and remodeling, we're going to hypertrophy or grow that segment, and it's going to basically move into that space, neuroforaminal space where that nerve exits. So the foramen is the hole that exits the spine. That narrowing actually is going to come from the thinning in the space between the disc and potentially that hypertrophy of the facet joint. So, well, damn, Trevor, I mean, if I've remodeled the structure, like, what is my move? Like, you're talking to me as a PT, is this something you guys can even treat? And we'll get to that. And the answer is yes. We're going to get to that and why and where you should go, who you should see. Do you need an MRI? I'm going to answer those questions coming up, but I want to get through the rest of these conditions. So hold that thought. I know what you're thinking. We're going to get to that. So some of you have had the unlucky diagnosis of something called spondylolisthesis. So some of my favorite diagnoses, this is to say, is spondylolisthesis. So it's actually a degeneration of the disc to a level where that instability has caused one segment to move upon the other. So one segment slides forward. So based on the grade of it, it can get to be a little more serious because you can actually compress a nerve. And in some cases, if the disc is too unstable, if the segment is too unstable, then, it may be out of a PT's hands. However, in some cases, I'd say even in the grade 1s and grade 2s, and even a couple of the grade 3s, we've had their treatment has actually resolved a lot of their symptoms. Is it going to fix an unstable segment? Well, I'll answer it this way. The structure itself, the loss of space, the segment sliding upon one another, isn't necessarily as important as what your symptoms tell you they are. So how your body feels is going to lead most good surgeons' decision as whether or not you're a surgical candidate. You can look at MRI all day long, but you're not treating the MRI, you're treating the patient. So it's important for us to understand, do you respond to therapy? Do we respond to some of these other treatments that can keep you off of the operating table? And if the answer is yes, then you're treatable. You're treatable regardless of the kind of findings of the MRI, which is why it's not that critical for us to get an MRI before we go to PT. So I wanted to talk to you a bit about some of the traumatic injuries, so the motor vehicle type injuries that are caused that lead to lower back pain, falls, and some of the structures that get involved in some of it. So rear end collision, we've got muscle, ligament, tendon, disc, you name it. It's all on the table as to what could be traumatized depending on size of the vehicle, speed of the collision. These are two heavy forces, and, physics is going to imply itself onto us in some way, shape, or form. So if all of these stresses actually start to disrupt these tissues, well, what do we do to help try to mend it? So in the acute phase of this, the early acute phase, we'll say, is the first 24, 48, 72 hours of just managing mass amounts of inflammation, because we've traumatized a great number of structures across probably the entire body, depending on the severity of the collision. So phase 1 recovery needs to be related to inflammation management. Phase 2 is really going to be in that subacute phase where we got past that acute inflammation, and really we're going to start working on some pain relief techniques and start to do some gentle range of motion, some light soft tissue work, because if we've traumatized a lot of the structure, what will happen is, yes, you have that acute inflammatory event, but the inflammation gets a bad rap. It's a marker on these tissues for your body to heal and remodel this tissue. You don't want to retard inflammation completely. You don't want to stop it, because you're going to stop your healing process. We've got to find something that is, one, an appropriate amount so you can manage your day, get through life, and be reasonably comfortable and functional. But two, also have enough where our tissues are beginning to mend and get you back to where you were prior to injury. So, nerve can definitely get involved in a lot of these motor vehicle conditions as well, mostly because if we've had instability in the discs or instability in certain segments, we'll get a quick little kind of crush moment and set off a cascade of problems. So the nervous system can get involved, ligament, tendon, muscle. So getting into the hands of somebody who knows what the heck they're doing with a motor vehicle accident is going to be critical. And sadly, I had a gentleman who, and this is no more than 8 weeks ago, was driving in the night and came up on a construction zone with his lane ending, and kept signaling to get to the left and get out of his lane, and nobody really let him in. So he had to come to a complete stop, halt on the freeway. Somebody behind him not paying attention to what he was doing hit him somewhere around 60, 70 miles an hour. Woke up in the hospital to a degree where he was unconscious, doesn't recall the transport to hospital. It's pretty serious injury, and referred to a PT, of which I don't know the name of the place. I wouldn't share it with you if I did. But sadly, only a couple of weeks after his injury, having kind of been laid up a little bit, obviously muscles get a little bit weak, and the opinion of the therapist he saw was that weakness was what was really the source of his problem. So started immediately into strengthening, found his way back into the emergency department because of the amount of pain he was in. So you got to find somebody who understands these phases of recovery. It's critical. So, some people will say, well, it's too soon to start PT. It's not. If you know somebody has the skill to manage and grade the level of the therapy and the approach that you should be taking to get you through these phases of recovery. So I hate to kind of say that it's always this way or always that way. It's always going to be a very personalized approach based on what these conditions are telling you need to do. I can say it as many times as I can, and maybe you get sick of me saying it, but you're going to hear it over and over and over again, because most people are in this kind of, we need protocols, and PTs are definitely great at providing and creating protocols, but patients are not protocols. They're individuals, and we need to treat them as such. I'll get off my tangent side note soapbox here for a second. What other conditions should we talk about? One big one that always kind of comes up is sciatica. And I'll tell you, sciatica could fall under each and every one of these. So this kind of pinched nerve from trauma. It could be the disc bulge, the herniation. It could be the spondylolisthesis, anything. It could be the stenosis. It could be piriformis syndrome and irritability of a muscle that grabs this nerve and causes this kind of nerve-related pain that occurs. So sciatic nerve is really sciatic nerve pain is nerve-related pain that can come from 1,000 different places. It kind of fits under this umbrella. So I think people probably overuse the diagnosis sciatica, but for me, it's going to go back to how do we properly assess our situation, figure out potentially what the source of this nerve-related compression is, and get it taken care of. So there's some weird other causes of back pains, cancers, infection, otherwise, but it's certainly something that I don't get to see a ton in my clinical practice, fortunately, because our PMDs out there have caught tons of these and taken care of them. Rheumatic conditions or otherwise can kick off a ton of back pain, but these are definitely zebras, and for us, those previous kind of diagnoses, they're more the horse. So when you hear hoofbeats, you think horse, you never think the zebra. Some of these other kind of ankylosing spondylitis, cancer, infection-related low back pains, probably not best for our discussion here today. But how does PT kind of show up in this role of managing each and every one of these? So what should it be? What are my other options if it isn't PT? And how do I figure out if I'm actually dealing with the right people to take care of your specific condition? Because these are the questions you really want to know, right? So other options would include things like acupuncture, and I think acupuncture has its place within the recovery standard. In fact, I have an acupuncturist in my clinic who I absolutely adore. I love him. The guy's great, Jay Chen. If you haven't done acupuncture, get with that guy. That he understands maps of the body that I've never been shown. So the other options between acupuncture, massage, chiropractic, seeing your primary doctor, going to an ortho spine specialist, going to PT, do I do decompression? How does this all fit in? So I want to kind of take them one by one. So back to acupuncture. How does things like acupuncture kind of fit in to manage low back pain? Well, truly, the purpose of acupuncture is identifying these meridians and areas of the body that you can start to manipulate to alter your symptoms of pain. So where getting your body back into a proper balance can help you kind of get back to a level of getting your body to begin to heal. The power of it is truly that pain relief. If we can manage and get some of these issues under control and get your pain managed, then it may improve our ability to do our job, which would be potentially the core strengthening, the functional aspects of things, and get you moving right away. So generally speaking, the PT's role is the strength conditioning function component of this, but perhaps some flexibility or otherwise. And sadly, that's usually where it ends, and it shouldn't. It really shouldn't, because PT has gotten to the point where it's gotten so incredibly watered down to do what insurance kind of will cover for PT. What you get is a very closer to a personal trainer type session. They learn or teach exercises or give you handouts of what to do on your own, and rather than get their hands dirty, so to speak, get their hands on the client, work on manual therapy techniques that can alleviate pain, to engage muscle groups to help support the spine, and kind of help this process along. And the impact of it for our approach of physical therapy is tried and true, tested over 20 years of my career. The stuff works, and I'll have it stand against any of the other practitioners that don't spend as much time one-on-one with their clients or put hands on their clients. So massage, seeing a massage therapist. So, in any field, you're going to see good and bad. So the spa massage in the big box stores where you got your memberships, it has its place for some of these conditions like your overuse, your strained muscle groups, but it also needs to go back to, is there an underlying instability issue that I need to address in combination of getting the soft tissue work done? It's why I have a soft tissue mobilization specialist, a massage therapist in my clinic that, if there's a component where, I can't spend the amount of time it's going to take to get this tissue put right, let's get you onto a massage therapist schedule so I can make my job a whole lot easier and focus on some of these other foundational pieces to get you back to health. Now, chiropractic can be, you would think I would just be out here just bashing chiropractic and, hey, they're competition to you. And really, I don't see it that way. Just like PT, just like any other field, there's good and bad in every profession. If you're the chiropractic office that just does the same 5 to 7 adjustments for every client that runs through the door, you're probably not a very good chiropractor, or where you're going may not get you the outcome that you're looking for, so to speak. But if you're a chiro that actually understands the ins and outs of, all right, we need the neuromuscular kind of systems to function together, that they instruct you in the proper exercises at the right level that can dose it and graduate and move you along that process to help you restore core stability while you get the joints to begin to move properly, decompress some tissues, depending on the kind of condition that you're dealing with, then you might be in a decent chiropractor's hands. There are a few. I've run across them. They're rare. The people who treat like me are incredibly rare. You're getting, as I said, a very standard in-network type PT is, for a low back pain patient, is giving somebody wig wags, hugging their knee to chest, and maybe getting to a point of doing some bridges or some clamshells. And it's really not going to get you what you're looking for long term. While you might get some relief, I'm sad to say, it's going to be something that's probably getting worse in the background until you see somebody who's got a little more skill, a little more tools in their toolbox to unwind and figure out this puzzle and see where each piece needs to go to get you back to proper health. Seeing somebody who does decompression. So it was like, this was this week. This was a phone call of somebody who was kind of upset, got evaluated by somebody who offered them decompression, without kind of a full assessment. They thought it was a very cursory assessment per se, and really didn't give them a proper explanation as to what their condition was, why this was going to be the thing to address it. And after even a few minutes on the phone, you found out that, hey, decompression was probably a reasonable recommendation, but somebody who isn't communicating with you what the actual outcome, the reason why you would potentially need it, and, oh, by the way, I want to sell you something that's $4,000. Yeah, I can get why you're shopping around here. So, decompression has its place, just like acupuncture and massage and stretch and chiropractic for those that know when to and when not to offer chiropractic adjustments. So for me, if we're talking about an instability issue, something that's worn over time and become unstable, an adjustment, a high velocity technique on a segment that moves too much, while you can gain some relief, long term, you may be worse off than having not gotten that adjustment to begin with. And there are some chiros that are very more conservative when it comes to actually adjusting everybody and anybody that walks through their door. So we love those guys. Don't want to, lump you all in under the same vein of chiropractic. I don't want to be lumped in with every physical therapist, because I'll tell you, people, there's only a level that sits you at the top to get to the top level of people. 20% of people, I would say, are probably actually really good at their job. You want to try to find those people, and I want to teach you how to find them. So how do you figure out who's good and who's not? That's where we really wanted to dig into. Who's good, who's not? Well, one, who's going to take the time to listen to what your condition actually is, so they can, number one, understand what's going on. And I'll tell you, more often than not, a veteran clinician knows what's going on without a lot of that. Honestly, you can hear a few cues, and you have basically a hypothesis, a working hypothesis that you need to put hands on to confirm. But you need to do it for the patient to understand that you understand. So this is why this lady who denied going to decompression, it could have been something where it was an appropriate recommendation. The patient didn't feel it because shortcuts were made. somebody who's taking the time to help you understand that they understand and that you understand what's going on. You got to get on the same page with these issues. So that's really the difference between a good clinician, an average clinician, and a bad clinician, is somebody who's actually taking the time to understand your condition. Second, are they quick to put hands on and identify specific things and explain to you what they found, why this is contributing? Could they potentially apply some treatment to you and show you that it made a difference? Can you see that something happened that made a substantial difference in your condition to prove to you that what their approach is going to be the solution to your problem? So if all of those things make sense, if all of these things line up, if they actually demonstrated their skill and their knowledge and got you an outcome, you're in probably somebody's hands that's pretty good at what they do. If they can do that very quickly, teach you in a way that you understand your condition and can lay out, hey, this is what's going to happen in this phase. This is how many times you need it. This is what is going to be the progression. Can basically future cast you and kind of time travel with you and tell you, this is what's going to happen. Here's how you're going to feel. This is why this may take a little longer. You should get really symptom relief early on, but this is something that you may want to continue because the underlying structure is still unstable. So if somebody's just coming in and saying, hey, relieve my pain, we can do that, but it may not be the best thing we can do as physical therapists, because if you came in and said, hey, relieve this tooth pain, Mr. Dentist, but they told you, you know what, it's actually coming from one above, but they decided, you know what, once we got you out of pain, you're fine. And now 2 years later, you have to have 2 teeth extracted. Well, you probably would have paid to have this properly taken care of to preserve your tooth. Well, the same thing occurs with the lower back. Some people just come, get the pain relief and leave, and their problem is actually degenerating, and the back is losing the integrity and stability over a lifetime. So it's important that somebody understands their issues, can explain it to you, tells you this is what is going to happen in these phases, and can take care of your problem, soup to nuts, so to speak, and can really get you what you're looking for. So I wanted to wrap that there with a bit of the discussion of the lower back. I know I kind of rambled a ton, spoke a ton, maybe side tangent a time or 2 or 3, but I hope you got something from it. I hope you enjoyed it, guys. So I wanted to get with you regarding that health tip and trick of the month. And it is related, here's our callback, to water and hydration. So we talked about 70% of that disc structure is water. And if we are in a dehydrated state, we are going to lose water content. We're going to lose space. We're going to lose cushioning to the lower back. We're going to be in more pain. So I want you to go check out our blog, why you need to drink more water to help relieve it. It's over at formfunctionpt.com. Go check out our blog over there. You're going to love it. What else is going on? We've got some promotions going on. So this month, we've got a $35 promotion for an intro for PEMF. Well, what is PEMF and why would I need it? Well, PEMF stands for pulsed electromagnetic fields. And the therapy that we provide is actually guided through our practitioners' hands. And what is it? What does it do? So PEMF is kind of an electromagnetic field. So that magnetic field actually provides energy to the cells for them to repair at a faster rate. PEMFs way back in the 1970s were first initially FDA approved as bone stimulator for non-union fractures. So this helps with bone, ligament, tendon, nerve, skin, wounds, burns. There's a ton of treatments, conditions that this particular modality can treat. And so we've had this Electrons Plus device that we've used in our clinic for a good long time now. And we've seen some incredible results. And I'd say 90% of our clients will pre-test, post-test them. If it's shoulder mobility, if it's bending over and reaching over and touching their toes, and then providing the treatment, 90% are showing an immediate change within that session. So if you are looking for some relief, you're looking for some technology, you're looking for something maybe you've never tried before, thinking you've tried it all, and really are out here searching, seeking new types of treatment to get you the relief you're looking for, come to our office. It is pulsed electromagnetic field therapy. Cool thing is, does anybody else use this thing? One of the most recent purchasers of it was the Kansas City Chiefs. So if it's good enough for Patrick Mahomes, and you got to bust out $35 for it, I think it's well worth your time to come on over. So, all right, guys, we're going to wrap that there. Hope you enjoyed the episode. Thanks for tuning in. Thanks for stopping by. Thanks for being so patient, waiting for me to get this one out to you guys. We will catch you on the next one. Don't forget, like, subscribe, comment, questions, reach out to us. We'd love to hear back from you and kind of help take this conversation a little further, a little deeper. We'll catch you on the next one.